Good morning everyone, and welcome back to another day in the life video. This week we are hopping back into clinic for our ICE2 experience, integrated clinical experience with my ICE group. So I'm very excited for that. I'm going to be in an outpatient orthopedic setting, so it'll be great to get some hands-on skills again. But to start off this weekend, I don't have very much homework at all to work on, so I'm just going to enjoy myself and start off by celebrating two of my friends' birthdays today. One in advance who's going to be having their birthday during our ICE experience, and another whose birthday is today. So I'm going to head off there now and just have some fun. This morning ended up being a little bit of a crazy morning just because my alarms just didn't go off, and I ended up waking up 5 minutes after I was supposed to be at work already. So it was a very rushed morning, but I ended up getting there in about 10-ish minutes after waking up and had a pretty good time there overall. Didn't have too many issues and just kind of got to relax because I don't really have too much to do. So after work, I went and got lunch with my girlfriend, and then I went to just play soccer for a little bit and have some fun before I head off to clinic this week. But now that I've had my fun, I'm going to do the final preparatory things for clinic, which include, I've already scheduled an email that will go to our clinical instructor about our assignments that we have, so that way they have a virtual copy. I think I'm going to still print off a physical copy to give to them at the start so that they can have it right off the bat. And then just kind of doing maybe a bit of meal prep and making sure that I have my outfits all ready to go. So there's lots to do, but I'm really excited for this week, so I'm going to get to it now. Good morning, everyone. We made it to our clinic this morning. It's about 9:35 right now, so we just have to wait a little bit for the rest of my team to show up, and then we're all going to go in there, get a quick tour, and then we're going to start treating patients right away at 10. So I'm super excited for today, and I'll see you all later. Well, it ended up being a really good day overall. First day is all done. I ended up having some great opportunities to interact with patients during the day. I was able to think of good chances to utilize my manual therapy, as well as adjust my exercise prescription to make sure that it was just tough enough for them to get the most out of it. So I'm very happy with how today went. But it's pretty late, so I'm going to get some rest before we're up again tomorrow for clinic from 8 a.m. until 5 p.m. That is day number 2 of clinic all done. Now I am heading straight over to work right afterwards, to work from 6 until 10 p.m. And then I pretty much just got to get ready to go for the next day. So it's definitely going to be very hectic this week because I will be working 3 shifts, one today, one on Thursday, and one on Friday. So I'm going to, while I'm there, try and work on reviewing some of our musculoskeletal conditions, since we're getting right back into that this upcoming semester, or at least second mini semester that we have. So that way I can be ready for the comprehensive exam that we have of all of the musculoskeletal conditions that we've gone over for every region of the body. So there's definitely still lots to do. Couldn't say definitely there. But I am happy with how today went. I had the chance to work with the same partner, Angela, and we've been rocking it with our patients and doing really well. Our clinical instructor is saying that overall our group is interacting well with our patients and there's very little for us to improve on, but she's going to start nitpicking these next couple days just to make sure that we get as much as possible out of this experience. So I am almost to the gym and I'll talk to you guys probably tomorrow when I'm done. That's day number 3 done. Overall, we're still doing extremely well and having a lot of fun. Today, I actually had one of our patients joke around with me and saying that I was managing to catch every little detail to really connect everything that they needed to in order to perform the exercises correctly. So I think I was able to provide some great cueing as well as just kind of progress them to make sure that they're getting what they need out of the exercise, even if it wasn't what I originally planned, which is really awesome. And just getting more experience with my hands-on skills and that exercise prescription that I thought was going to be initially really hard, but I'm finding that it's actually coming relatively easily and I'm able to progress and regress all of the exercises that I have been prescribing. So I'm very happy with my progress, but we don't have anything else planned for the rest of tonight since pretty much my last 2 nights have been pretty busy. I just want to take some time to not really do much, just enjoy some dinner, maybe play some games, maybe review some of my stuff if I really feel like I need to, but overall just kind of have a low-key evening since I am going to be working again tomorrow night and the following night. So this is going to kind of be my midweek break, so I'm going to take advantage of it. Crazy enough, it's already Friday. It's been a very busy week overall, but yesterday went really well. We continued to go through the motions and get a better feeling of exactly what Outpatient Orthopedics is as a team. And we even saw a few of the same patients that we've seen earlier in the week, so we got to kind of see a little bit of that continuity of care, trying to advance exercises, seeing sometimes when we needed to regress them because the patient wasn't feeling the best that day. So overall, it's been a great experience so far, but now we are here early because I wanted to beat traffic since traffic is really busy around 7 a.m., which is when I needed to be here. So it's about 6:35 right now. I have this today, and then I am going again straight to work from 5 until 9 afterwards because we'll get off at 4. So it should work out pretty well timing-wise, where I should get to work on time. But it's going to be really busy, but I'm excited for today, and we're going to keep pushing through. We made it to the end of our first week of our integrated clinical experience, and I am so happy with how it's going. I believe over this week, we've had some great interactions with patients, actually seeing some improvement just in the small week that we have been working with them, as well as gotten to become more comfortable with exercise prescription and just being in the outpatient orthopedic setting as a whole. So I'm extremely happy. I'm excited for next week. If you want to see more of this and hear more about my experience in this integrated clinical experience, make sure to check out week 2 of our integrated clinical experience next week before we dive back into classes to finish off this semester. If you enjoyed, please make sure to like and subscribe down below. Thank you all so much for watching. This has been KBDPT, and I'll see you all in the next video.